Most people with undiagnosed diabetes are not sitting in a doctor's office getting bad news. They are at home, going about their lives, completely unaware. Because for years, the disease works quietly, below the surface, doing damage that does not announce itself with pain or a dramatic symptom. It announces itself in places most people never think to look, their feet. Every year in this country, more than 8 million adults are walking around with type 2 diabetes and have no idea. According to the Centers for Disease Control and Prevention, roughly 1 in 3 Americans over 65 already has diabetes, and a significant portion of them do not know it yet. The problem is not that the signs are invisible. The problem is that nobody told them where to look. A quick note before we go any further. This channel provides general health education drawn from published research. I am not your doctor. Nothing here is a diagnosis or a prescription. Never change a medication, supplement, or treatment on your own based on anything you hear today. If anything on this list sounds familiar to you, that is a conversation to have with your doctor this week, not a reason to self-diagnose. With that said, here are 9 things your feet may be telling you right now. Things that cardiologists, podiatrists, and endocrinologists say seniors over 60 too often overlook, dismiss, or never connect to their blood sugar at all. Stay with me to number 3. It is one most people never associate with diabetes. And it is visible, right now, on almost anyone who has had uncontrolled blood sugar for long enough. You can check it yourself in under 30 seconds. Most people have never been told to look. Before we start, tell me your age in the comments and where you are watching from. I read these, and they shape what I cover next. You may also want to grab a seat and take a look at your own feet as we go through this list together. Now, here is what you need to understand before we go through the 9 signs. Because the feet are not just the farthest point from the heart. They are the early warning system of the entire circulatory and nervous system. And diabetes attacks both. Diabetes damages the body through 2 main pathways. The first is blood vessel damage. When blood sugar stays elevated over months and years, the walls of the small blood vessels, the capillaries and arterioles that feed the skin, nerves, and tissues, begin to thicken and stiffen. Blood flow slows. Oxygen delivery to the extremities falls. The feet, being the farthest point from the heart, are among the first to feel that shortage. The second pathway is nerve damage. High glucose is toxic to nerve fibers. Over time, it damages the coating around the nerves, the myelin sheath, and the nerves themselves begin to misfire, go quiet, or stop transmitting signals altogether. The nerves that reach the feet travel the longest distance in the body. They are the first to show the damage. Think of the body's circulation and nervous system as 2 parallel delivery networks, one carrying oxygen and nutrients through the blood, one carrying signals through the nerves. Diabetes gradually degrades both. The feet are at the far end of both networks. What shows up in the feet is often what is happening throughout the entire body, just further along and more visible, because the distance from the center is greatest there. That is why the feet are the window. That is why this list matters. 9. Recurring fungal infections on the toenails or the skin between the toes. Most seniors who develop athlete's foot or a thickening, yellowing toenail infection chalk it up to hygiene, to shared spaces, to simply getting older. And sometimes that is all it is. But when fungal infections keep returning, when you treat them and they come back within weeks or months, again and again, that pattern is worth investigating. Fungi, particularly the dermatophyte family responsible for most nail and skin infections, thrive in environments rich in glucose. When blood sugar is consistently elevated, the skin itself carries higher glucose levels, essentially providing a feeding environment that antifungal treatments can suppress but never fully clear, because the underlying condition keeps replenishing it. Think of it like trying to dry out a basement while a slow pipe leak is still running. You can mop the floor, you can run a dehumidifier. But if the source of moisture is still active, the mold keeps coming back. Antifungal cream is the mop. High blood sugar is the leak. A review published in the Journal of the American Academy of Dermatology found that people with type 2 diabetes have a significantly higher prevalence of dermatophyte infections compared to age-matched controls with onychomycosis, fungal nail infection, occurring at rates 2 to 3 times higher in diabetic populations. The elevated skin glucose environment is the identified mechanism. If you are treating a recurring nail or skin fungal infection that has been coming back for more than a few months, Ask your doctor to include a fasting blood glucose or HbA1c test at your next visit. The infection may not be the main problem. It may be a symptom of something the infection is feeding on. The next sign is even more common, and even more likely to be dismissed as ordinary aging. 8. Dry, cracked skin on the heels and soles that does not improve with moisturizer. Dry feet are common, but there is a specific quality of dryness that is worth distinguishing from ordinary seasonal skin. When the skin on the heels becomes deeply cracked, when the fissures are thick, persistent, and do not significantly improve with regular moisturizing, the cause may not be topical at all. It may be coming from inside. The sweat glands in the feet are regulated by a specific branch of the autonomic nervous system, the network that controls automatic bodily functions you do not have to think about: heart rate, digestion, sweat. Diabetes damages this branch of the nervous system too. When the autonomic nerves to the sweat glands are disrupted, those glands reduce or stop their output. The skin on the feet, no longer moisturized from within, becomes dry in a way that no amount of lotion can fully correct, because the moisture is supposed to come from inside the skin, not just the surface. Think of it like a plant that has been cut off from its water supply. You can miss the leaves, but if the roots are not drawing moisture up through the stem, the leaves will keep drying out no matter how much you spray them. The American Diabetes Association identifies anhidrosis, the reduction or absence of sweating, as a recognized consequence of diabetic autonomic neuropathy, and dry, cracked foot skin is listed among the early visible signs. A 2021 clinical guide published in Diabetes Care noted that foot skin assessment, including dryness and cracking of the heels, is a standard component of the annual diabetic foot exam precisely because it signals autonomic nerve involvement. If your heels have been cracking or your foot skin has been persistently dry in a way that does not respond to normal care, this is worth mentioning to your doctor, particularly alongside any other symptoms on this list. 7. A burning or tingling sensation in the feet, especially in the evening or at night. This is one of the most recognizable early signs of diabetic peripheral neuropathy, and one of the most frequently dismissed. People describe it as a warmth that should not be there, a mild electric sensation, a feeling like their feet fell asleep and are waking up, or a buzzing that starts after dinner and keeps them up past midnight. The mechanism is the gradual degradation of the nerve fibers that run to the feet. As high glucose damages the myelin coating around these fibers, they begin to misfire, sending signals when there is no stimulus to send them. The burning is not coming from external heat. The tingling is not coming from pressure. It is coming from a nervous system that has lost its calibration. Think of the nerve fibers as the insulation on an electrical wire. When that insulation begins to wear away, the wire starts sending false signals, flickering, sparking, running current when it should be quiet. Your feet are not hot. The wire is shorting. A landmark 2005 paper by Andrew Bolton and colleagues, published in The Lancet, established that diabetic peripheral neuropathy affects approximately 50% of people with diabetes over their lifetime, making it one of the most common complications of the disease. The paper identified burning and tingling in the feet, particularly worsening at night, as among the earliest patient-reported symptoms, often preceding a formal diabetes diagnosis by months or even years. If you experience burning or tingling in your feet that is consistent, unexplained by another cause, and noticeably worse in the evening, please bring this to your doctor specifically. Request a fasting glucose and an HbA1c. The symptom itself is manageable and often reversible in early stages, but only if the underlying blood sugar is identified and addressed. 6. Swelling in the feet and ankles, especially noticeable in the morning or after sitting. Some swelling in the feet after a long day is normal, particularly in older adults. But there is a specific pattern of foot and ankle swelling associated with diabetic kidney disease, nephropathy, that is worth distinguishing from ordinary fluid accumulation. The kidneys filter excess fluid, waste products, and protein from the blood. When chronically elevated blood sugar damages the small blood vessels in the kidneys, those filters begin to fail. Protein that should stay in the blood leaks into the urine. Fluid that should be regulated starts accumulating in the tissues, particularly in the lower extremities, because gravity pulls it there. The swelling is not from standing too long. It is from a filtration system that is beginning to fail. Think of the kidneys as a dam with a filtration screen. When that screen is damaged, water is not the only thing passing through. Solid material passes with it, And when the material passes, the pressure on one side drops, and fluid starts moving in directions it was never supposed to go. According to the National Kidney Foundation, diabetic kidney disease, diabetic nephropathy, is the leading cause of kidney failure in the United States, and lower extremity edema is among the recognizable signs of declining kidney function in diabetic patients. A clinical overview published by the American Diabetes Association notes that foot and ankle swelling, particularly when it is bilateral, persistent, and accompanied by protein in the urine, should trigger evaluation of kidney function in seniors with known or suspected diabetes. If your feet or ankles are swelling consistently, particularly in the morning before you have been on your feet, this is not a symptom to manage with compression socks alone. Ask your doctor for a kidney function panel, including creatinine, GFR, and urine albumin. 5. Changes in the color of the skin on the feet or lower legs. This is a symptom that people notice and then talk themselves out of. They assume it is a bruise they do not remember getting, a circulation issue from sitting, or simply a mark that has always been there. But persistent color changes in the feet and lower legs are one of the more reliable visible signs that blood flow to the extremities has been compromised. There are 3 color patterns worth knowing. The first is pallor, an unusual paleness or whitish tone, particularly when the leg is elevated. This suggests arterial insufficiency. The blood is not reaching the foot with adequate pressure. The second is a dusky reddish-purplish color called dependent rubor that appears when the foot is lowered below heart level. This is the body maximally dilating its arteries to compensate for poor flow. The third is a brownish rust discoloration on the lower leg called hemosiderin staining, caused by red blood cells leaking from damaged capillaries into the surrounding tissue. Think of the blood vessels in the legs as pipes with a pressure gauge. When the pressure is right, the color is healthy pink throughout. When the pressure drops, when the pipes narrow, the color at the far end goes pale when the demand is low and dusky red, when the body is struggling to compensate. The color is the gauge. It is telling you what the pressure is doing. The American Heart Association identifies peripheral arterial disease, the narrowing of arteries supplying the legs and feet, as 2 to 4 times more common in people with diabetes than in those without, and skin color changes are among the clinical signs used by vascular specialists to assess disease severity. A 2020 consensus document on diabetic foot disease published in Diabetes Care included skin color changes in its framework for identifying limb-threatening ischemia. If you have noticed unusual color changes in one or both feet that persist over days or weeks, this is a prompt to bring up with your doctor. A simple test called the ankle brachial index, a blood pressure comparison between the arm and the ankle, can tell a physician a great deal about how well blood is reaching your feet. Now, number 3, the one I told you to stay for. And here's why I told you that you can check this yourself right now. 3. Hair loss on the tops of the feet and lower legs. Take a look at the top of your feet and your lower shins. If you are a man and the hair that was once there has thinned or disappeared without explanation, or if you are a woman and there is noticeably less fine hair on your lower legs than there used to be, this is worth paying attention to. Hair follicles are among the most metabolically demanding structures in the skin. They require a consistent, healthy blood supply to maintain their growth cycle. When peripheral arterial disease reduces blood flow to the legs and feet, the hair follicles are among the first structures to lose their supply, because they are a low-priority destination for a body managing limited circulation. The follicles do not die immediately. They thin. They stop producing. The hair retreats from the feet first, then the lower legs. Think of hair follicles as small factories at the end of a long supply chain. When the supply chain is disrupted, when deliveries slow down or stop, the factories at the farthest end of the line are the first ones to go idle, not because they are broken, because the resources stopped arriving. A 2019 clinical review published in the journal Vascular Medicine identified loss of hair on the lower extremities as a classic physical examination finding for peripheral arterial disease used by vascular physicians to quickly assess the adequacy of blood flow to the legs. The review noted that this finding, when combined with absent or diminished foot pulses and cool skin temperature, is highly suggestive of PAD, and that PAD in the context of diabetes significantly elevates the risk of non-healing foot ulcers and amputation. Look at your feet right now. If the hair is significantly thinner or absent on the tops of your feet, and you have not been told why, bring this to your doctor's attention specifically. Tell them you want to know whether your circulation to the lower extremities has been assessed. 2. Cuts, blisters, or sores on the feet that are slow to heal, or that you did not notice until they were already there. This symptom is perhaps the best-known foot complication of diabetes, but it is consistently underestimated until it becomes serious. A small blister from a shoe, a minor cut from trimming a nail, a pressure sore from walking. In most people, these heal within days. In someone with poorly controlled diabetes, they can persist for weeks, become infected, and in severe cases escalate to outcomes that require hospitalization. The mechanism involves two converging problems. The first is vascular. The narrowed blood vessels of diabetic, peripheral arterial disease reduce the delivery of oxygen, immune cells, and the proteins needed to build new tissue. Without that supply line, the biological machinery of wound healing runs at a fraction of its normal speed. The second problem is immune dysfunction. Chronically elevated blood glucose impairs the function of white blood cells, reducing the body's ability to fight the bacteria that inevitably colonize an open wound. Think of wound healing as a construction project. You need materials, oxygen, protein, growth factors, delivered by the blood, and you need security. Immune cells clearing the site of infection. When diabetes disrupts both the delivery trucks and the security team, the project stalls. What should take 3 days takes 3 weeks. And in 3 weeks, a minor wound in a contaminated environment can become a serious one. The statistics here carry real weight. Research published in Diabetes Care found that non-healing diabetic foot ulcers precede approximately 85% of lower extremity amputations in people with diabetes, and that earlier identification of high-risk foot characteristics reduces that risk significantly. The American Diabetes Association recommends that every senior with diabetes receive a comprehensive foot examination at least annually, including assessment for neuropathy, circulation, and wound healing capacity. Examine your feet daily. This is not an exaggeration. It is a standard recommendation from every major diabetes organization, specifically because neuropathy can remove the pain sensation that would normally alert you to a problem. We will return to that point in a moment, because it is the most important one on this entire list. And now, number 1. The symptom that diabetes specialists and vascular surgeons say is the most dangerous of everything we have covered today. Not because it is the most painful, precisely because it is not. 1. Numbness in the feet, a loss of sensation that means you can no longer feel pain, pressure, heat, or injury the way you should. The ability to feel pain in your feet is not just a sensory experience. It is a protection system. It is the alarm that tells you when a shoe is rubbing too long, when the bath water is too hot, when you stepped on something sharp. When that alarm is disabled, when diabetic peripheral neuropathy advances to the point where sensation is significantly reduced, the foot becomes vulnerable to injuries it can no longer report. Here's how it happens. Prolonged elevated blood sugar damages the long sensory nerve fibers that carry signals from the feet to the brain. These fibers are responsible for transmitting the sensations of light touch, temperature, and pain. As they degrade, those signals weaken and eventually stop. The feet go quiet. And in that quiet, injuries accumulate. A blister that was never felt, a cut that went unnoticed, pressure from a tight shoe that caused tissue death before anyone knew there was a problem. Think of the sensory nerves in the feet as a security camera system covering the most remote part of your property. When the cameras are working, you know immediately when something goes wrong. When the cameras go offline, one by one, quietly, the property is still vulnerable to intrusion. The difference is that now, nothing is reporting it. The damage happens in the dark. This is why loss of sensation is categorized as a medical emergency in the world of diabetic foot care, not merely a discomfort. A clinical study published in Diabetes Care found that patients with loss of protective sensation, the formal term used by podiatrists, have a lifetime risk of developing a foot ulcer of approximately 15% and a dramatically elevated risk of lower limb amputation. The American Diabetes Association's Standards of Medical Care in Diabetes, updated annually, specifically identifies the loss of protective sensation as the single highest risk finding in a diabetic foot assessment, triggering an escalated care plan and more frequent monitoring. If you sit down right now and run a finger lightly along the sole of your foot and find that the sensation feels dull, reduced, or absent compared to other parts of your body, please do not wait for your next routine appointment. Call your doctor this week. asked to be assessed for diabetic peripheral neuropathy. There is a simple, painless test called the monofilament test that takes under 2 minutes and can determine whether protective sensation is present. Ask for it by name. And if you have not had your blood sugar tested in the past year, particularly if you recognize 2 or more symptoms on today's list, ask for a fasting glucose and an HbA1c. These 2 tests together are the most direct way to know where your blood sugar has been over the past 3 months. Now let me tell you about someone who represents the pattern these symptoms show up in. Consider a woman in her late 60s. Call her Gloria. She had been managing mild high blood pressure for several years, nothing dramatic. A few months before her diagnosis, she had noticed that her heels were unusually dry and cracking. She had been using lotion for weeks with little improvement. She had also had a stubborn toenail infection that treated and returned twice. She chalked both up to getting older, to the dry season, to the fact that she was on her feet a great deal. One evening, her husband noticed that the top of her left foot looked slightly reddish and swollen. She had not felt anything. She had been wearing a new pair of shoes that week, and without knowing it, a blister had formed on the outside of her toe and had been there for several days. She had not felt it because sensation in that foot had already been quietly reduced for longer than she realized. Her physician ran a fasting glucose and HbA1c at her next visit, something he had not done in over a year. Her HbA1c came back at 8.1. She had had undiagnosed type 2 diabetes, almost certainly for 2 or more years, and the foot signs had been there the entire time. Gloria's situation is a composite, drawn from the documented patterns in the clinical literature on late diabetes diagnosis in older adults. But the sequence is real. The dry heels came first. The nail infection came first. The numbness came quietly, in the background. The blister was found by someone else. Most cases of undiagnosed diabetes in seniors follow a version of this pattern. The signs arrive one at a time, each one individually explainable. It is the cluster that reveals the picture. So here is what the science keeps telling us, and what this list is built around. The feet are the earliest, most visible, most accessible window into what the circulatory and nervous systems are doing. And diabetes, before it ever announces itself through a blood test or a crisis, writes its early chapters in the feet. Dry skin, fungal infections, color changes, burning at night, hair disappearing from the lower legs. These are not random aging phenomena. They are a nervous system and a vascular system under chronic stress, showing you, if you know where to look, that something is happening that requires attention. And here's why the timing matters. Diabetic complications that have been developing for 1 or 2 years without treatment are often significantly reversible with proper blood sugar management, lifestyle change, and appropriate medication. Complications that have been running for 5 or 7 years unchecked are far harder to reverse. The window is real. Acting in it changes the trajectory. Here is your plan starting today. Pull off your socks and examine your feet carefully. Top, bottom, between the toes. Look for any of the 9 signs we covered. Feel the skin. Note whether the sensation feels symmetric and normal. Check for any wounds, blisters, or discoloration you were not aware of. If you find anything, note it, write it down, and bring the full list to your doctor. Then consider when you last had a fasting blood glucose test and an HbA1c. If it has been more than a year, or if you have never had one, request both at your next appointment. These are inexpensive, routine tests that carry an enormous amount of diagnostic information. If you are on any medication for blood pressure, cholesterol, or any other cardiovascular condition, do not stop or change anything on your own. Bring this list to your doctor as information, not as a self-diagnosis. Your physician's job is to interpret what these symptoms mean in the context of your full history. Your job is to make sure they have the complete picture. If this video gave you something useful today, please share it with one person over 60 in your life. A parent, a sibling, a neighbor who mentioned their feet have been bothering them. You do not have to say anything alarming. Just tell them there are 9 things on the feet worth knowing. That one share may be the thing that gets someone tested a year earlier than they otherwise would have been. Tell me in the comments below, which of these 9 signs did you already know, and which one genuinely surprised you? I read every response. If this gave you something, the next video I want you to watch covers the 7 blood pressure readings that doctors say seniors should never ignore. Specific patterns in your numbers, at specific times of day, that signal something more serious going on beneath the surface. Most people with abnormal blood pressure patterns have never been told what to look for in their own readings at home. I will walk you through each one. Watch that one next. Tr-twons, ones, ones, ones.